Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor who sees quite a few patients with knee problems, this particular article really connects with what I've learned in almost 25 years of practice, and that is that most meniscal tears, whether they're traumatic or degenerative, don't need surgery. And I'll kind of clarify, there's usually one particular scenario where surgery really isn't, it's now becomes required. But we saw it before because people think that they have a meniscal tear and they think that I have to have surgery because they're told that it doesn't have a very good blood supply and it doesn't heal very well. That's not really true. Most meniscal tears will heal well on their own. When I was 18, I actually, not knowing what I know now, I actually injured my knee playing football with some friends, tore the meniscus. I ended up having surgery on it. If I knew what I knew now, I'm pretty confident that I wouldn't have followed the same path. I did tear a meniscus in jiu-jitsu, maybe 2 years ago. I did everything I would do with a patient that came in through the office, and I think it was my left knee. I really can't even remember because it doesn't bother me one iota anymore. And that just jives with what I see in patients in my office. So all of this started with a placebo surgery quite a few years ago done by the military, because we generally don't do placebo surgeries. And because you don't want to cut somebody open and not do anything just for the sake of research. Well, the military did that. And they first started with debridement of the knee. So just kind of going in there, cleaning out. And it turns out that a year later, the people who had surgery and didn't have surgery, there was no difference. Then they did this same concept with degenerative meniscal tears. And same kind of thing. Fast forward, there really wasn't much of a difference. We've seen the same thing with traumatic meniscal tears. And in this study, it was a follow-up out of Netherlands, 278 people, aged 45 to 70 years of age, and it followed them for up to 5 years, looking for degenerative tears, and basically found that after 5 years, there was no difference between the people who had surgery and the people who had rehab. So what I would suggest is it's not a matter of just letting it heal on its own, because I don't think that's a good idea. I think that you need to do whatever you can to get the knee to heal correctly. And in this particular study, they used 16 sessions of physical therapy. I'm generally not a fan of strengthening the knee, although what I think is probably one of the most important is working on the soft tissue. So in our office, we use an instrument-assisted soft tissue mobilization, a particular one called Graston. So basically, exercise, whether it's therapeutic exercise, whether it's supervised exercise, movement becomes important. The worst thing you can do for any type of knee problem is not move. The only exception, I will say, is that when the knee locks up, when the meniscus folds over and now the knee locks, it is possible there are some adjustments that can release that meniscus. But if it does not, those really are the conditions that will probably always need surgery to unlock the joint. So exercise, we need to move. As I mentioned, we need to get the soft tissues around the knee functional and working properly. That involves, we've got one particular tool that I'll use here. This isn't the one that I would use on a knee, but it gives you an idea that we can use this to in a controlled fashion, damage injured tissue so that it can heal properly the next time around. But some form of instrument-assisted soft tissue work, I think, is critically important for any knee problem. We also have a whole body vibration unit. This isn't accessible for most, but you'd be shocked at how much a whole body vibration platform can bring back stability to knees without aggravating them. So let's say you can't do exercise because things hurt too much. A whole body vibration plate with very small squats can usually solve that problem there. There's also a study on TENS units helping with knee osteoarthritis. I think that what that really is it allows the knee to be more comfortable while people are doing whatever exercises so that they don't let pain deter them from being more active. And then the last one, relatively, a lot of the regenerative stuff has become far more popular in the past couple years. That includes things like PRP, platelet-rich plasma, stem cell, the hyaluronic gel injections have gotten better, and prolotherapy, where they inject a sclerosing solution. All of these things are designed to really get to the root of the problem. A lot of these soft tissue instruments can't get to the meniscus, so we just have to fix everything around it and allow the body to heal. But some of these other techniques can actually get to the surface and stimulate more healing. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.